BostonSight's podcast audience. It's a pleasure to be speaking to you again today. For those of you who don't know me, my name is Rob Rothman. I am a glaucoma specialist by training, and I do still clinical. I am still in clinical practice, taking care of glaucoma and anterior segment patients about half the time, and then the remainder of my time is spent managing InFocus Capital Partners. InFocus Capital Partners is an ophthalmic specialty venture capital fund that invests in innovative technology in the ophthalmology space. We are currently in the process of raising capital for our second fund, and looking forward to seeing some of those assets start to mature in the very near future. Today's guest, it's kind of funny. Today's guest is somebody who I've known, I don't know, a long time. It's got to be more than, maybe it's 20 years already, maybe a little bit more, maybe more
Right.
than 20 years. And I will take, I don't know, 1% of the credit for educating him. I don't know, maybe 2% of the credit for educating him, as he was a resident at the facility where I was both educated and trained and involved in training. Um, but he has become much greater than just a former resident, and we'll let him explain that why that's the case. But today's guest is Dan Brox. Dan is a cornea trained ophthalmologist who is also the CMO at BostonSight. And for many of us who are not cornea specialists, we may not know who BostonSight is, but I can tell you that every single cornea specialist on the planet at this point knows who BostonSight is, and we'll get to that in a few minutes. But Dan, thanks for being on the podcast today.
Thanks for having me. Good to see you again. Yes, it's been 15, 20 years, quite some time. It's unbelievable.
I know, I know. It scares the hell out of me when I see people, becoming like real members of society, kind of like my own kids, they grow up and then all of a sudden they have like real jobs. And I said, well, wait, how did that happen? But it's great to see. Um, so Dan, one of the things that I like to do on a regular basis is kind of let people introduce themselves. Like, tell us a little bit about your background, how you got to where you are today, follow a little bit of the where you grew up, educational plan, all that stuff.
Sure, yeah, definitely. Thanks for having me again. Definitely appreciate it. I love your podcast.
Thank you.
And as you know, I went to Tufts undergraduate first, and I went to Tufts Medical School, and then I went on to North Shore LIJ, where I trained the group there, including you, for ophthalmology residency. Then I did my fellowship in cornea and external disease with Penny Asbell at Mount Sinai. So I stayed nearby there as well. And then after that, I kind of followed along with my long-term plan, which was to join my dad in private practice. He's is an ophthalmologist as well, and he's up in Poughkeepsie, New York. And I practiced with him for just about 10 years or so. Then he retired. And at that point, I started thinking about some of the things I was always thinking about, other areas of ophthalmology that I wanted to get into, whether it be education, research, um, and get a little more into the pioneering parts of ophthalmology. And I would often spend a lot of time thinking day to day, all these things that we hand out, all these innovations that occur in ophthalmology. We owe so much to the people that are doing that day to day. And as doctors, we utilize all these things, but I wanted to get a little bit more involved in kind of creating those things. So started looking around for different things. And I ended up here at BostonSight, where I've been for a little over 5 years now, 5, 6 years, and been working here on clinical care. So we have a clinic here that we see patients in every day, all day long, that need specialty corneal care, and also working on research and development of new innovations and evaluating the use of different products BostonSight makes in clinical care, and also very involved in education. So it provided me the opportunity to be here and kind of seek out some of those opportunities I was looking for, continuing with clinical care, just as you do, and continuing with education, and then also getting into research, which was really part of my career that I wanted to build out a bit more. And there was a real need at BostonSight to utilize a lot of the resources we had here in a research capacity. So that's kind of what I worked on building up as I got here, was one of my main projects when I started here.
Yeah, it's great. I mean, it's so many people who it's amazing, and it's a theme that I think permeates most of the discussions that I have with physicians who end up in non-direct patient care roles, myself included, is this kind of desire to do a little bit more than just taking care of patients, right? It's kind of a common theme where, and it's not because taking care of patients isn't fun anymore. We still get the same personal satisfaction out of caring for people, right? But
Hmm.
there's sometimes where you just feel like you need to do something a little different, a little bit more broad reaching, and that seems to be the same motivation that you had.
Right, definitely. And I mean, we live in a time as doctors where that opportunity is there. I mean, I don't think that existed. For instance, when my father was in ophthalmology, I don't think there was as much of that. Doctor equaled going into clinical care and spending your day in the office, which is great. Like you say, no doubt about it. That's a privilege for sure as well. But doctors have a lot of other interests, and there's a lot of opportunities these days to get into those interests, and you see a lot of doctors taking advantage of that. So it's certainly been a great opportunity here, and it's interesting as you're doing with your podcast, hearing about how a lot of people in our field in ophthalmology have gotten into all different parts, and I think the profession is much the better for it. I think
Yeah.
we've really grown in a great way because of it.
Yeah, one of the reasons I do these podcasts is because it provides a continuous reality check for what I'm doing. I'm like,
Right.
okay, I'm not the only guy who's trying to, make a difference outside of the clinic, but it's great to hear that you're similarly motivated. So tell me a little bit about, Boston Sight. I think that, as a glaucoma specialist, I have probably heard the term PROSE lens, I don't know, 100 times from
Mhm.
cornea colleagues who say, oh, they need a PROSE lens, and I'm like, okay, great, whatever the hell that is.
Right.
I'm a glaucoma guy. I don't,
Right.
care all that much about the ocular surface, although I probably should have a little bit more consideration of it in my life, but it is what it is. And but I don't think anybody, at least outside of the cornea sphere, kind of knows about it. So can you talk a little bit about the relationship between Boston Sight, the PROSE lens, and what the PROSE lens is?
Yeah, sure. And I had a similar experience. Despite all the education we go through, some things we don't concentrate on as much. And I did, cornea fellowship, and I came out of practice not really knowing too much of it. It was kind of this esoteric thing that people would throw around and they would use for different things. It kind of seemed far out there and that sort of thing. But I remember when I was in private practice, I had a patient that I first used it on, a patient that had acoustic neuroma and had exposure, couldn't close their eye. And someone had recommended it to me that this, non-healing defect and the eye was just, doing so poorly that I should send the patient over to Boston Sight for a PROSE lens. So I didn't totally understand it completely, but I did it. I sent the patient over there and they came back 2 weeks later and the thing that hadn't been healed for months and months and months was healed. The patient was the happiest I'd ever seen her. And she was putting this lens in and day out. I'm looking at this lens, not knowing much about it. So that one patient that did so well kind of sticks in my mind and was the person then that really motivated me to say, hey, what is this thing? Because you're exactly right. Like as ophthalmologists, I think it'd be hard pressed to find an ophthalmologist that doesn't know that term pros. But I think most of the people using that term still struggle with what am I talking about exactly?
Right.
What am I really saying? And so, I kind of started to get into just, on my own, getting some of these people that knew a little bit more of it in my life and learning more about it, referring more patients. And I kind of learned from that. That's where my interest grew. And fast forward to me being here in the capacity I'm today, it has really obviously grown my understanding tremendously. But Boston Site was started long before I came here. It was 1992, 1993, and it was really built out of this technology that was being used in a few other places or being thrown around a few other places where they create a lens that sits just on the sclera, just really on the conjunctiva, of course, overlying the sclera and vaults over the cornea and the limbus. And it's filled with preservative-free saline every morning. So the patient disinfects it every night, takes this lens that's a larger diameter, as you might imagine, and fills it with preservative-free normal saline and place it on the eye, and its touch points are just on the conjunctiva. And that fluid that it's filled with serves a lot of amazing purposes that we understand now. One, you could just have a patient with irregular cornea. When you put that lens on and the fluid in the lens, that neutralizes all the irregularities. So you could have a patient that walks in with keratoconus 2400, you put even one of the trial lenses on them, all of a sudden they're seeing, 20/20, 20/30, these sorts of things. So it can just be used for, best corrected vision. And then it also has this other part of it where it's protective, or provides this kind of nourishing environment to the eye. So if you have people that are breaking down ulcerating, like GVHD patients, Sjogren's patients, pemphigoid patients, just really bad dry eye patients, you put them in a lens like this, it provides them comfort because obviously covering the nerves and the cornea. And it also provides this environment where the surface will start to really heal under it. So kind of live under this world where patients with any variety of need for best corrected vision or comfort or support of the surface of the eye, any of those disease states come in to see us, and the lens can address those issues. And every lens needs to be customized to every single patient. So that's where it comes into being a bit more involved, where these patients literally come into the clinic. They have all these customization measurements taken, and then that's sent to the manufacturing lab, which we have here on site that manufactures the lens for the individual patient. So the basic like construct of BostonSight is a clinic and a manufacturing lab. And that manufacturing lab services the clinic on site here, right outside Boston, but also the manufacturing lab is producing the lenses for clinics across the country and internationally to provide them with access to the technology.
And is the so it's great. I mean, obviously, my sense is, and again, clinical experience would tell me that this is for people with severe dry eye problems, like you said, non-healing epithelial defects, or certain conditions where regular kind of more conservative therapies don't work. But
Right.
is it's a customized process. So what are the limitations to getting it to the broader population? Does it require people specialized on site? Is this something that can be, kind of done by anybody in any office? How does the process work?
Right. So that's a big part of it. And there was very much like underutilization of this treatment modality, but for good reason, because access to it was very limited in the years that BostonSight started. You literally had to come to one place on the planet. You had to come to BostonSight in Needham, Massachusetts to get this treatment. And people would travel in, internationally or across the country and these sorts of things, but that access was a real issue. So things have changed. You used to come into the office and there was only that one way to do it. Now there's really two sets of products, if you will. There's PROSE, which is all the like bells and whistles, every customization you could possibly imagine in this world, making to a lens or customizing for each individual person. That exists in what's called a PROSE lens. There's also what's called scleral lenses, which is kind of that offshoot that improved access to care. And what that is a more limited customization version of these lenses that's available for commercial use. In other words, a clinician in a private practice will have like a trial lens set and will be able to place that lens on the eye and make some customizations for each individual patient. Or we even use imaging technology now where someone can sit their patient right in front of the pentacam and it will scan the patient's eyes. And that data is literally sent over to our manufacturing lab, and the lens is manufactured based off of that data. So these sorts of processes, having access to these trial lens sets, having access to just imaging technology has opened it up for people all across the country and all across the globe. And we have individual network sites where we train practitioners to learn all these processes, but that's a pros uh, product or a pros process. And then we have these more limited trial lens sets and sets that can be not as involved to use. And that's the scleral lens. So there's different avenues to get access, and I think it provides the opportunity for a lot of practitioners to get involved.
So that's great, and I think obviously technology will help you expand the access, even more over time. But how does the cost work? So it sounds like this is expensive, right? I can't imagine that
Right.
anything that's customized for a patient is inexpensive. So is it a pricey process? Does that have any limitations as well?
Yeah, that's part of the access to care for all the things that we do, It much more complicated than I think any of us would wish for it to be. But starting just with like BostonSight proper here, uh, we're a nonprofit charitable organization that's part of our focus. So when patients come in here, they go through the process of how to ensure the patient can get access to this. So we provide a lot of subsidized care. We provide free care when that's appropriate, obviously, and when that's needed, which is extremely frequent. So that's a large amount of our patients that are receiving some subsidized or free care. So that's certainly how we work in terms of making sure there's access to care. But of course, not everyone can do that, and understandably so. So the Pros product is much more expensive with all those customizations and all the time that's spent, the chair time and all these sorts of things, than the scleral lens patient, which takes more limited chair time and these sorts of things. And it can vary by insurance carrier. Some insurance carriers will cover 100%, some will cover 80%, some will be non-covered, and it can be anywhere from hundreds of dollars to thousands of dollars, depending on which treatment modality is used and the person's insurance coverage and things like that. So certainly, I think that's one of the things that drives the market to say, hey, is this person, can they be on a cyclosporin drop twice a day and feel good with their dry eye? Versus, do they need something more expensive?
Um, so cost of care is obviously a huge, topic of conversation, right? And having just recently come back from the American Academy of Ophthalmology meeting, and certainly having a close connection to what's going to be presented at the OIS meeting next month in San Diego, there is a large part of the ophthalmic community that is looking at therapeutic modalities, novel treatments, both device and drug for the treatment of dry eye, right?
Hmm.
There is a significant, amount of innovation being directed towards this. And although I think the world mostly sees, big, retinal drugs being bought for, billions of dollars,
Right.
um, with, that may or may not be efficacious, not a topic for this podcast, but certainly that, can have broader impact. A lot of people have neglected, at least in the investor community, the anterior segment. And all these companies are out there looking at all these incredibly um, exciting technologies, but this is something that's very simple and available right now.
Right. Right. I mean, that's what gets me a bit excited about it, but there's tremendous opportunity for us as clinicians to utilize this modality. You're exactly right, that a lot of people don't know about it. It's underutilized and it's available right now. So there's certainly, there are so many patients we see that are struggling with dry eye or ocular surface disease, pain, discomfort. And I think, and we have clinicians, ophthalmologists come in all the time to visit to just experience a day of doing this. They see a couple of these patients, like a GVHD patient that's barely functioning from their eye pain. You put the lens on, the world dramatically changes in a minute. Or some of these keratoconus patients, pellucid or globus patients that are bad surgical candidates. They have these lenses on, their world opens up to them. So yeah, I think we do get sometimes caught up in what's next, what's next, what's next.
Right.
What's the new innovation, and we um, forget about some of these things that have been around for quite some time. And prose is very unique in that regard. I think, like you described in the beginning, it's always held this spot in ophthalmology as a little out there, or people just never really learn exactly about it. But I'm always encouraging people to, because to be honest, like, a lot of ophthalmologists, we really uh, like save them in certain situations. They're very thankful when they have these situations when they send patients in, like our oculoplastics colleagues. Sometimes they've done surgeries on these patients that have non-closure of their eye, or they've done, we have a patient the other day has 7 revisions of their eyelid repair from trauma, and these patients have tremendous pain and all sorts of issues dealing with every day. And the physicians are often the ones who are most thankful. Obviously, the patients are thankful, but the like oculoplastics doctor will say, "Oh my gosh, I can't believe this patient is not coming in every week now. They're, just getting this lens in their eye, and it's something that's been sitting there for them to use, all the time." So we're trying to remind our colleagues about it and remind them about utilizing it, because it's a fairly straightforward process and it's there for them to use, like you said, right now.
Well, what's the plan? I mean, so I mean, honestly, it's amazing how different, you know, and that you're the CMO. I get it, but I'm sure you have conversations with the business of your business, and what's the plan? Like, how do you, as a nonprofit, plan to grow your business for the point of generating more utilization? Ultimately, that can lead to greater revenue for the business and then further expansion of your product. But ultimately, do you have is there a plan to sort of expose more people to this, get it out there, let people know what they can do now, set up more fitting centers or whatever is required, or set up easier protocols for doctors to have access to it? Is there a strategy for that, or are you just going to kind of let it grow word of mouth amongst the cornea community by itself? And I'm not saying
Yes.
that there's a requirement for you to do that. I'm just saying it seems like, at least even from my limited knowledge of it, that this would be incredibly useful. I mean, just think about patients with, let's say, neurotrophic keratitis, right? Right
Right.
now,
Exactly.
those patients are spending hundreds of thousands of dollars on the
Right.
current pharmaceutical treatment for it, right?
Right.
And maybe they, so I mean, the question is, what is Boston Scientific's future plans for growth? Do you have any?
Right. No, well, that I mean, that conversation exactly like you're having is one that we've been having here over the years because long before I was here, it was BostonSight and it was this one center, and there are a couple of network sites, and they would just manufacture to those few sites, and people would have to travel to a couple places on the planet to get this done. But that's not a good long-term plan, of course. And so that's when you try to expand two things. One, like uh, how do we get this like lens out, or how do we get people able to do this in their clinic setting? And then once people decide they want to do it, how are they going to get that information to us? So there's really two aspects of it. One is that scleral lens product. We go from PROSE, this highly complex system where clinicians would even come and spend, believe it or not, like 9 weeks with us and do like a fellowship and get all the training on all the computer programs we use and everything about it, and then go back to their new site and start their pros center. Obviously, very few clinicians can take that time and do that. That's not a good long-term strategy, of course. So having a simple fitting set and being able to support a practitioner to starting up right with, a quick review of how it works and describing to them and supporting them as they go through that process, and then creating these systems where you don't need to buy all sorts of new stuff. For instance, just scanning a patient with a pentacam. This is kind of, there's a big growth in that. As ophthalmologists, we see pentacams or these products, scanning technology all around. And to just have a module where you can scan the cornea and the sclera and literally just send that information to the lab to manufacture is a big step forward. So it's really by creating more simplified systems so that these private practices all across the country can use it, or they can use their imaging technology that's even available to them this day in order to use this technology at their office. It's gone already from just having a few sites in the country to now hundreds of sites that have, you know, either pros, which is few, or this BostonSight scleral, we call it, which is the scleral lens product. That's that a more simplified version.
So, right. So that seems like a much better plan, right? So I would hope, and maybe you'll, tell us if you have any knowledge of it, how you guys are using your revenue to invest in, um, in making the process better, in making access to the process better. What are your plans for, getting this out there again? Because there's a lot of people with severe dry eye disease out there that I'm sure are not being exposed to this properly.
Right. Right. No, that's exactly right. And that's I always underscore, and I say it again and again, but the underutilization is there, and why is it there is the question. And it is about education. That's a big part of it. Speaking at meetings, presenting our results at meeting, publishing our results. So we've done some like retrospective series and things, but we had a lot of room for growth there. So the last 5 years, there's a lot of publications, but publications aren't any good if no one reads them. I always say that, everyone loves publishing, but there's a lot of journals we get every week. So you really have to go and speak about them, present them, educate our colleagues about it. That's a big part of it. The technology part, obviously, we spent a lot of investment in that in terms of simplifying the process for clinics to use and creating what we have as a web-based platform. So when clinicians go to our platform online, it makes it very straightforward for them to order these lenses online. Before, it used to be a lot of phone calls and discussions. There was nothing really standardized. You just would call someone, tell them what the lens looked like on the eye or what you wanted to do, and process didn't really work very efficiently. So you have these efficient systems that are in place now, web-based platform for ordering, these educational opportunities we are always working on. And we try to tap into what you mentioned as well, which is people are kind of always interested in the new and next thing. And so, the sort of innovative research we're doing, like my area of interest in research is using these lenses for drug delivery. So there are some people that I could say PROSE or scleral lenses, and I could see they're already not that interested. It's just not their thing. But
Right.
I'm trying to make it their thing. But when I bring up using this PROSE lens for drug delivery, they're like, wait, hold on, tell me more about this. And so I try to also initiate people into this world by some of our innovations and those things that we're working on. So that's piqued a lot of interest in the ophthalmology field about, oh, how are you using this, lens for drug delivery? And that's, the focus of my kind of research portion of things. And I think that helps gain excitement, and people from there start to think about utilizing it in their regular care.
All right, I'm going to take off my OIS podcast hat and put on my evil venture capitalist hat, for a second. I think it's fantastic that you guys have a not-for-profit structure, and I think the providing of care and access is something that you should continue. But has there been a discussion about turning this into a for-profit business to help grow and expand both your technology access and, just broadening exposure, putting
Right.
back the podcast hat now?
Right.
So I went from podcast to evil venture capitalist back to podcast.
Yeah, I think every place has discussions about different things, and other avenues to go. But this is our structure now. We have this, BostonSight, which is nonprofit, and then we have this wholly owned subsidiary. BostonSight scleral products are made through that group. So it's grown some where there was really just pros in the beginning, and that's it. We don't have any plans to adjust it any more than that at this time for sure. It's kind of how we're structured. But I definitely, we get those questions periodically about the structure, about investing in it. It's a different setup than most. It's what's kind of guided this institution for quite some time, and it's going to continue to be that structure as it is now.
Yeah, well, I'm just going to go out there and make a pitch for the OIS podcast audience and say somebody should reach out to these guys and try and figure out how to make the pitch that, taking in money and turning some profit is going to allow them to attract more and more patients and maybe benefit patients in a more um, large scale way. So that was the evil
Hmm.
venture capital hat, by the way.
No, well,
But
not evil. It's a
yeah.
good question.
Yeah, but I think that obviously, growing the business and expanding the care. I mean, I can tell you from my own personal experience, I have a few patients who I've referred to cornea colleagues,
Mhm.
for PROSE lens fitting, and it's kind of
Yeah.
remarkable how, how they heal and how much better they get, and it doesn't end up having to be treatment for life, right? It's, it can be
Yeah.
short-term treatment that allows recovery from something really bad, and then they can go on quote a more mundane and routine dry eye therapy that allows them to be much happier. But it's really been game changing for some of these patients, and there's no reason why it's a treatment that can't be applied to, let's say, moderate dry eye where other therapies have failed. But it's going to take a little work and a little capital for you guys to get that out of the cornea subspecialty world and into the world of mainstream ophthalmology.
Yeah, I think so. And it's we don't have strict definitions on these things, like where does mild end and moderate start, or moderate and then
Right.
severe. And so, I think you're exactly right. The patient that we may think as ophthalmologists is doing great may not think it's so great that my eye's doing well, but I put in artificial tears every 15 minutes.
Right.
That's not a life to live like that way forever, right? They say, hey, what else can I do? And so where those lines are a little bit blurred, and where people should consider something like this a little bit blurred. But we certainly have work to do to inform our colleagues about it, see where it's appropriate. Like you said, make sure they understand it's not just for that most severe patient who's in the middle of a melt and you need to try to save with anything possible. You want to catch these patients beforehand, and it can be life-changing for a lot of these patients that either are thinking about their eyes or pain constantly, or just have not have any sort of options for visual rehabilitation. So we do see that every day, and I always invite people to come by and see what it's about when they're in the area. And I think it can be surprising. Like you've luckily, it sounds like, had an experience with some of these patients.
Right.
And when you do have those experiences and they benefit from it, it's a bit eye-opening for sure.
Yeah. Well, listen, Dan, um, I think that it's great. I think, Boston Sight is a great organization. And the more I've learned about it from you and in my, initial research prior to the podcast, it was pretty exciting to know that you guys are a company and your structure is unique, being able to take care of patients, turning, revenue that's generated into free care for people with severe disease. It is as virtuous as it gets out there in the world of ophthalmology. Congratulations on that, and thank you. I hope that at least a result of, or maybe a partial result of this, is that there is somebody who comes, listens to this podcast, and says, "Hey, I want you guys to be busier. I want you to get out there and come to more patients. How can I help you on the finance side?" And it would be great to see that occur. But um, thank you for your time today. Thanks for exposing the audience to what you do and who you are. I certainly wish you continued success. And obviously, if you decide to expand out into the world of, larger growth, make sure you keep in focus on your radar for a conversation. But um, it's great to see how a little bit of education in the past, as a little bit, maybe a little bit of me got in there and helped you down this path. So thanks for taking the time today to speak to everybody.
Thank you very much. I appreciate it very much. Thank you.
Thanks, OIS podcast audience. Looking forward to the next conversation down the road.